Hi there, my name is Victor Abiodun. I'm a third year medical student here at St George's, and I've just been asked to talk a little bit about my experiences of studying here at St George's. So the first thing I say to someone that's holding an offer for St George's is actually just to come and see the university. So come to one of our open days and really come and see what's going on, because I think that's one of the most important things you can do in terms of deciding where to go. So 3 years ago, or rather 4 years ago now, I came to see St George's, and I was really struck by the community feel. So St George's classically only have healthcare topics, and I thought that might perhaps detriment from the university experience, but actually I came and saw that the people here are actually very normal, very down to earth, and actually they're quite friendly as well. So I think that was the main thing that I really thought about St George's. Despite its small size, it actually does have a lot to offer. The second thing that I'd like to say is just the range of societies as well. So St George's have really great societies which do lots of different things. If you're into athletics, if you're into dance, if you're into music, they do all of that kind of thing. And it really shows in terms of the diversity of student that you have here as well. The next thing that I've been asked to talk about is just a bit about the course structure. So I'll just explain a little bit what's going on. So the course is 5 years, and over those 5 years you're learning medicine, as it were. And when you graduate, you're a doctor. So that's how it works, it's as simple as that. And in the 5 years that you're here, the first 2 years are really geared towards you learning your clinical knowledge. So you're learning a bit of science, you're learning how to communicate with patients, you're going on the ward a little bit quite early on as well. And some of these lectures, for example, you'll be doing with other professions. So you'll be having lectures shared with biomedical scientists, with physiotherapists, with radiographers, and a number of other students as well. So I think that's quite good, but early on you're actually sharing your learning experience with other members of the multidisciplinary team, if you like. And then as you specialise a bit more, you spend more of your time in small group seminars, in teaching scenarios, and CBL/PBL learning situations. So that's really what the first 2 years look like. And then really, what happens after that is you're going on to awards from year 3 onwards, really armed with the knowledge that you acquired in the first 2 years. So I think that's what's really good about St George's, is sort of the approach of learning is really geared around your experience with patients, and that really helps in terms of trying to get your head around different topics. Okay, so I'd just like to finish off by saying some of the things I've really enjoyed about being here at St George's. I've already mentioned the community feel, and I feel that's one of the most important things. I'd urge anyone that comes to St George's in their first few weeks is just to get involved with a society, with different groups, anything like that. Come down to one of our events, because it really does help in terms of your experience here at St George's. The other thing I like about St George's is actually its location. So St George's University is obviously affiliated with the hospital, and the hospital is actually one of the largest in the UK, and it's recently been designated as a South London trauma centre. So this means that you're getting really interesting cases coming through, unique to St George's, and I think that really adds to the learning experience here. As well, as part of your teaching, you can be sent to some nearby hospitals as well, which also have dedicated teaching facilities as well. So really those are the things that I've really taken from my experience here at St George's. And finally, I'll just talk about what I'm planning to do with my degree when I finish. So in 2 years' time I'll graduate as a doctor, and after that I'll spend some time working in between hospitals, and that's classically for about 2 years, and then you start thinking about what you want to specialise in. So there's actually a lot of scope for development whilst you're here at St George's and when you graduate.